Welcome, viewers. Once again, we are with you, bringing a subject which you might have seen from very far distance. Probably, as security professional, this is the time to appreciate what goes behind perfect healthcare, perfect patient care. They are security professionals who look after security of hospital, and hospital are such institutions where people are reaching there with high level of anxiety. Either they themselves are sick and infirm, they are patients, or they are patients' well wishers, and in their desire and urgency of looking after their patient, at times they create conflict, conflict of interest for their own sake as well as other customers. Health services are committed to providing a safe and secure environment for patients, staff, and visitors. Hospital security arrangements keep them safe from inappropriate behavior such as violence and aggression. Having the proper level of security in a hospital can provide protection and peace of mind for all the patients treated at the facility. Hospital security responsibilities also extend to protecting the doctors, nurses, and all other staff members who deserve a safe workplace. To discuss the intricate approach towards perfect patient care and hospital security, we have with us Shri Jeetendra Singh, Certified Security Manager, who is Chief of Security at Fortis Healthcare. Welcome, Jeetendra, for this discussion.
Thank
For
you,
the
sir.
viewers, uh, my pleasure and privilege to make your introduction. For our viewers, Jitendra looks after security concerns of Fortis hospitals in NCR region. He started his career in hospitality sector and migrated to healthcare sector. This career transition has enriched him, and his professional acumen is probably making a balance of both the critical sectors so far as sensitivity and care for customers is concerned. He has seen both the sectors very closely, and from the point of view of security function, catering to both internal and external customers which are facing security threats and are often security threats themselves. So this security function is full of paradoxes, inherent and internal contradictions, and making a balance makes someone a very perfect security professional. So as perfect security professional, Jitendra, you are most welcome, and I would like to know from you how you make a short difference between hospitality sector and hospital sector. So we will start from there, and then as you develop the discussion and the subject, let's see how we navigate through the intricacy of this professional niche segment. Yes, Jitendra, please
Thank
go
you,
ahead.
sir. Thank you, sir. That was quite an elaborate description of me. Perhaps I don't deserve that much appreciation from you. Uh, Luckily, I started my career with the hospitality industry, so I knew that one has to be very non-intrusive in approach when he or she is dealing with a patient. More than patient, the attendants are uh, quite under stress. You rightly pointed out. So, if the security design in a healthcare setup is intrusive in nature, it is bound to bring a lot of situations, needless to say, disasters. Uh, Security in a healthcare setup is tasked with managing the internal and external disaster scenarios that most of the quality metrics demand us to do so. And when we talk about internal and external disaster scenarios, we all pretty much know how many scenarios are there and what all we need to do. I'll go back in the history of evolution of healthcare security, sir. So that will give you and viewer some understanding as to uh, how this particular security operation evolved from hospitality and airlines. It's rather it's a mixture of both the security functions, I would say. So when the healthcare security started in private setup, it was some 25 years or so. Before that, probably the security in healthcare was non-existent. There used to be a couple of security guards deployed in hospital, and they would inadvertently report to the medical superintendent of the hospital or the admin officer of the hospital. Gradually and slowly, the private hospital groups like Apollo, Fortis, Max, and Medanta came, and then there was a need to have an organized setup in the healthcare delivery facility, which ensures the safety and security of patients, the medical practitioner, the paramedics, and the other staff members. So uh, now the big task was, where do we get our quality metrics from? And if we talk about times, some 2.5 decades back, there were hardly any defined metrics, hardly any board of certifications except the JCIs and all, which were still a distant dream for Indian healthcare delivery facilities. NAVH was still in formulation. So the professionals who joined the private healthcare setup at that point of time, they devised, and it is apt to say that they took most of the metrics from hospitality and aviation security and airline security. So if you look at our security SOPs, many of them have similarity with the hospitality as well as the aviation security. Now, when we talk about the SOPs that we have, around which our daily activities revolve, there are around 25 to 30 odd SOPs that binds our work, and our day-to-day life revolves around those SOPs. Uh, when we talk about security design in the healthcare industry, uh, in the initial stage, some 25 years ago, it used to be uh, as much possible non-intrusive as is it used to be in hospitality. Now, in 10 years or so, when the Mumbai attack happened, the healthcare security industry started started copying, or rather started evolving, uh, in order to ensure that they are self-sufficient in order to manage the challenges and risk coming out from the situations that was arising out of the terror attack on the healthcare facility. Healthcare facilities were targeted in 2008 when we talk of Mumbai terror attacks, and uh, two of the hospitals, one in Mumbai and subsequently one in Ahmedabad, were hit, and staff members were killed. Now, considering the situation that if a hostage situation happens in a healthcare facility, the results are bound to be disastrous. So, hospitals then hospitals, especially the healthcare service provider, dropped the idea of having a non-intrusive security design, wherein the security was not much into doing the security checks and all. They started a mixture of intrusive and non-intrusive security design, and after 2008 till today, they have evolved a lot, and the security design from being non-intrusive in nature has become pretty much intrusive. When we talk of last 2 years of COVID situation, it has become more intrusive in nature than its earlier design of being non-intrusive and more accommodating uh, for the patient and patient attendant. Now, when we think from the patient perspective, it is very difficult to check a patient. In a hotel, probably we can check a patient, we can check a patron, we can check a guest, we can check his visitors, but in a healthcare setup, checking of patient doesn't arise. I mean, the question of checking the patient doesn't arise. Checking of attendant, yes, it is happening these days. And COVID, the way we used to look at this checking and intrusive, non-intrusive design of security, it has changed a lot. So now security is checking the patient attendant, their vaccination status, their physical well-being, their body temperature, whether they are infected, they are not infected, and security has uh, probably taken more center stage than any other function these days, and it has become the first point of contact for anybody who's visiting a healthcare facility. Now, right from the gate till you land up in the patient care areas, inpatient areas, or you land up in a doctor's OPD consultation chamber, you find certain degree of security involvement. So our SOPs have also been edited, they have changed, and up to an extent, we have become intrusive in nature without without getting into the I would say personal details of the personal medical details of the patient, the the vaccination status and other details are being checked so that we don't end up infecting our own workers. And in spite of that, in spite of all this precaution, all this intrusive nature of security design, we see a lot of situation and scenarios wherein our staff member have got infected, and that has led to a lot of crunches in manpower, and then leading to a situation wherein leading to a situation wherein the attendance of patient uh, got anxious whether their patients are being their patients are being looked after appropriately or not, and that in certain situation has led to various sort of reactions, inappropriate behavior from patient attendant, and that has naturally increased the pressure on the healthcare delivery professionals. Now, these days, the hospitals are suffering from single biggest problem, which is the perception management. We must understand that any service that comes with a cost, and somebody has to bear the cost. Now, when people demand a good service, probably a five-star service, they forget that there's a cost associated, and that cost has to be borne by somebody. So if the results are favorable, there is no problem. If the results are not favorable, in certain cases, let's say we lose the patient, or the patient is not cured, it leads to reaction from patient attendant, and that is pretty disruptive in nature and is bound to have adverse effect on the operations, hospital operation, and may create problem for the well-being of other patients. Now, controlling that requires security to interact with a lot of other functions of the hospitals, and security being from the front of the house function of the hospital pretty much provides input to the patient care services, the medical administration, even up to an extent the supply chain management, F&B, patient welfare. department, and those inputs are accepted by the concerned department, and they are used in order to ensure that the uh, adverse perception which is growing in the mind of the patient attendant is avoided. And uh, it is very heartening for me to say that in our hospital, and in fact not in our hospital, rather in most of the hospitals, private healthcare setup, security heads are pretty much involved in providing inputs about the patient attendant, their thought process to the concerned department and concerned function of the hospital, which leads to better perception management and better interaction with the patient attendant, so that the internal peace and tranquility in the facility is maintained. And other than this, the reactions from patient attendant is avoided. So this is one aspect of maintaining the internal security situation in the hospital. If we talk about the disaster management framework in the hospitals, uh, the internal disaster situations like fire, flooding, or if we talk about the fight or mob attacks or hysterical patient or violent attendants, or various type of security situations like theft, pilferage, etc. So that is managed by the security function. And external disaster situations like flood in the area, terror attack, fire, or any big accident leading to influx of patient in the hospital, bomb threat, bomb explosion, or earthquake situation, or maybe tornado or any natural calamity leading to uh, influx of patient to the hospital, is also up to an extent managed by the security, because the security then becomes the first point of contact when a patient comes to a healthcare facility uh, seeking treatment. And if plenty of patients turn up at the same time in the hospital, it will bring down the emergency ward operation, and leading to a lot of chaos, and at times attack on the hospital, fight, or historical reaction from the patient attendant. During the second wave of COVID, we pretty much had the similar situation, wherein a lot of instances were there, wherein there were beds not available. A lot of people who came were being managed in the emergency bay outside the hospital building, and the healthcare service provider were trying to do whatever they could do. And we all know that there was scarcity of medical oxygen, medical supplies, medicines. So, in spite of all those hardships, uh, almost every healthcare service provider tried providing medical care, primary medical care to the attendant and attendants, to the patient. And attendants were pretty much anxious. And now allowing those attendants to roam around here and there in the hospital would have had other consequences, leading to infection among the staff member, and then compromising the hospital operations. So during those times also, the security was almost in the center stage, and uh, the non-intrusive design of security was left aside, and we ensured that no violent situation occurs in the hospital. Other than that, we ensured that supply of medical consumables, medical gases are are given priority, and a lot of liaison work happened with the local police and the local administration along, and we supported the hospital management in order to get those medical consumables, medical oxygen, There were situations most of the hospital in Delhi NCR faced in last year's second wave of COVID, that they were left with 30 minutes or 40 minutes or maybe an hour's supply of medical oxygen. And we can easily imagine the condition of patient attendant, more than patient probably didn't even know that the hospital's oxygen supply is going to end. It was the attendant who were more concerned, and there were likely to be very violent reaction from them, including arson and fight in the hospital emergency. And some of the hospital in Delhi NCR witnessed violence in their emergency, and that was pretty much disturbing. And it also, created a lot of hindrance in the delivery of medical care to the patients, the very sick COVID patient. We had also seen, as healthcare security professionals, that the hospitals also came up with very innovative and dynamic ideas, wherein they converted the entire hospital as a COVID hospital. So last 2 years of handling of various situations were very enriching. The entire hospital, all the functions of the hospital learned to evolve, to bring in certain design changes in the hospital operation in order to ensure that the COVID patients are handled properly. Their services are continued without infecting our most of the staff. There were plenty of staff member who got infected and probably went through a lot of hardships. In spite of that, the patient, and more than patient, their attendants were managed, their emotion, their their anxieties were taken care of, and in certain cases, the security guards who were standing at the gate of the wards, at the gate of the hospitals, interacted, calmed down the attendant, ensured that a lot of dialogues happened. They also acted as a medium of communication between the attendants, patient attendants, the relatives of patient, and the hospital management, without 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 hindering the operations, medical operations especially. So this is in a nutshell about the healthcare security operations. I would like you to show the slides that I wanted our viewers to see, which talks about our involvement and the initiative that we usually uh, we take in healthcare security operations. So, if we see, our involvement is pretty much in the access control, be it visitor, be it medical representative, be it contractual workers or contractual agencies. We are into asset control. We are into material movement process management. We handle the time office as well. And unlike hospitality, the healthcare facilities have the concept of metal keys. So we have around, if we talk about one of these facilities, just to give you an idea, around 16 to 17,000 keys. I mean, there are 16 to 17,000 location which is managed by the metal key and lock. So those areas access are managed by the security. Other than that, the important aspect of healthcare security is to manage the mortuary, medical legal cases, death case handling, uh, liaison with various government agencies, and handling difficult situations like fight, hysterical patient, mob attack, and over intrusive press, etc. We also are responsible for maintaining surveillance, be it electronic or physical, in the facility. We are responsible for theft, pilferage control, and in case the theft and pilferage happen, the investigation and their reporting. Traffic and handling of VVIP movement and their stay is one of the responsibility which is tasked to the healthcare security. Other than that, we contribute significantly in internal and external disaster management and emergency codes management.
So, Jitendra, you have pretty well explained what is hospitality security and how it is different to what you do presently. Hospital security, healthcare security has primary concern about patient care, and sometimes patient or patients attendants become a nuisance. You mentioned that it is a kind of a responsibility, and I see it as a challenge to security personnel that those who are mentally stressed and out of their anxiety and concern, they become sometimes unmanageable. Handling them is a big, professional challenge. Is there any special training given to security guards in hospitals so that psychologically they understand the trauma and stress these people have and react accordingly, or it is just generalized training and let's do it and handle it? Uh, what do you see? The percent of training thereof in hospital sector has undergone some change, or it is still continuing the old routine way?
Sir, I think in last 1.5 decade, a lot of changes have come in the training of security guards and the supervisors, those who work in healthcare sector. Earlier, yes, we used to train them on a lot of soft skills and being non-intrusive about a patient and its attendant, and we were to be pretty much sensitive about the secrecy of medical records and medical information of a patient and the attendant. But in last 2 or 3 years or so, a lot of change have come, and since we carried out an analysis wherein we found that during last 2 years, uh, all the healthcare delivery facility have witnessed a lot of violent incident, and to manage the violent incident, uh, it was essential that we bring in a lot of qualitative change and quantitative change in our training modules. Uh, the frequency was increased. A lot of talks happened with the security personnel so that they are not stressed out and they do not react adversely, leading to escalation of security situation in the hospital. So those things happened. They undergone a lot of training session wherein they were trained to handle the stress. Luckily, we had a department of psychiatry, medicine, and the doctors from those that department trained, and they came up with a lot of modules which uh, which trained the attendees how to manage the stress in given situation. A lot of hand holding had to be done with our security officer
Quick
and security
interjection
person.
here, Jiten, quick interjection here. The
Yes, sir.
training the attendee is very useful. I don't think, because when patient goes out, attendees also go out, but your security guards remain. Let the secretary department train your security guards to handle these fellows better. Would it not be more fruitful and productive?
Yes, sir. I meant the attendees. I mean, not the attendants of the patient, but the attendees from the healthcare facility. I mean, the hospital staff. I meant the
Okay,
hospital staff.
security guards included.
Yes, sir.
Right.
That included the representative from all the functions, including security. So we ensured that the security guards, their supervisors, and the security officers, they undergo those stress management session. And it happened in the early days of COVID in 2020, I would say. And after that, when we had trained security supervisor and officers, we did a lot of hand holding with our security guards because they were getting infected, their families were getting affected. So we ensured that this category of people, those who have undergone this kind of infection because of somebody's irresponsible behavior or non-disclosure of his infection status, so we ensure that they do not react adversely and lead to a further escalation of situations. So
So, as all professionals have been telling since December 19, when we heard first time the name of coronavirus and COVID, present normal is going to be the norm. So even when this is abnormal situation, I do not think that professionals' approach towards their respective profession is going to change. Today in hospitals and healthcare sector, security guards would be given additional skills and additional responsibilities, which today they think they are handling because of abnormal situation. When even things are going to be normal, security guards, security teams' responsibility is going to be same. I don't see any change. They will still be, at the gate, monitoring the patients, attendants, even patients themselves, and then taking temperature and sanitizing, and then you see intrusive and non-intrusive security checks. They will be like that only. And in that, there is a mention you made about perception management. Perception management becomes again, another addition to security's responsibilities. How would you be handling this perception management? Because conventional security guards training does not include that in their syllabus.
yes, sir, very rightly said. So, a lot of a lot of hard work goes into ensuring that security guards, they know about perception management. The guards, those who are deployed in the healthcare facility, they are at least, they undergo training every day, in every shift. I'll say not the weekly or monthly training, but every day's training regimen is given to them. And during those training sessions, they are always reminded that if if their actions are empathetic in nature, if they are reacting with certain degree of empathy to a patient attendant, so there will not be any adverse perception about the hospital. At the same time, they have to ensure that in order to be empathetic, they do not jeopardize the medical processes. Like, I'll give you one small example. If the security guard deployed or security supervisor deployed in the ICU area knows that there's a terminally ill patient who will probably pass away, he may tweak in the rule, he may tweak the process and allow couple of attendants to the ICU in order to ensure that they see their patient for one last time. And that has a huge bearing in the mind of the attendant, and they know that yes, although during this time it is not allowed to visit the hospital ICU without a proper vaccination, double vaccination status, and RT-PCR negative status, they will for sure know and appreciate that the security person, and not the security person, because the security person is representing the hospital, they'll for sure know that the hospital was empathetic to them and they allowed them to see their near or dear ones for one last time in the ICU when they were on their deathbed. And if you do not allow that, the patient dies, and then the attendants are bound to react violently and adversely. So the security guard is given sufficient authority in order to be empathetic. But at the same time, if there's a ICU round of the doctor is happening, he will have this much authority to ask the attendant to wait for some time so that the medical rounds are over and the other patients are well attended by the doctors or the medical practitioner, and then the attendant goes inside the ICU and sees. So a lot of dialogue happens between the security guard and the patient attendant or the patient relative in order to ensure this. And this is how you manage your perception that the hospitals are not typical, blood sucker leeches who suck the money out of you and do not give you proper care, and they are not empathetic at all.
Another point I would like to get response of is mortuary. In fact,
Yes, sir.
this place, especially the attendant of the patient. But when there is a need to go, what for the patient realize that their patient's attendant realize when they go to mortuary that the dear and near one is no more and body is handed over, which is mutilated,
Sir, I
not
was not
properly
able. Yeah, sir, I was not able to
mutilated.
hear the first part of the question. I'm sorry, I'm
So
interjecting. Yes, sir.
no,
If you could,
let me say, you can react combinedly because there is only one question.
yes,
So
sir.
there are no notorious rats in the mortuary,
Yes, sir.
and body is damaged,
Yes,
or
sir.
embalming is not done properly, or packing is not done properly. So those attendants of the patient, when they go to the mortuary and see this, there is big scene created. I never knew that security guards are involved in mortuary handling also. But
Yes, sir.
if they are, then probably they are required to handle this not conventionally. It is something entirely different, and it is from here and from heart. Both faculty must work properly. Empathy, you use that word empathy. So, how do you see situation developing at mortuary, and how best these are to be handled?
Yes, sir. So, sir, the mortuary is the essential part of healthcare facility operation. Uh, how it used to happen in the past in various setup where there were no responsible department or responsible person except the mortuary caretaker. This body part being eaten by the rodent and all, this used to happen. These are the things of past. In my last 14 years of service with the private healthcare setup, I have not come across a single incident wherein the body parts were damaged by the rodent. Yet the rodent problem occurs in the hospital. Let me be very honest about it. It can happen in any of the facility where you have food particle and food substances, and lot of rodent infestation may happen. But if you go to any private healthcare or any government setup, if the mortuary is properly designed and maintained, the chances of body, and if it is kept in a proper fridge, mortuary fridge, the chances of body getting or body part being eaten by the rodent is very less. But there is another bigger challenge wherein the bodies are swapped. And there have been cases in the past in various healthcare facility. It came in the newspaper as well that body of a COVID patient of a lady was handed over to someone else, and someone else's body was given to those attendants. It came in the newspaper as well. So that happens when the staff is under a lot of pressure, the training, and their number, the adequate number is not being maintained. So this body handover, dead body handover process is a very serious one, and a lot of involvement from the senior team of security officer happens. A lot of involvement right from the guard who's deployed at the mortuary site to the supervisor and the security officer happens when the body is handed over. The mortuary in a healthcare setup is actually operationally managed by the medical team. There are 3 to 4 departments are involved. First is nursing, second is biomedical engineering, which manages the mortuary fridge and all. Engineering department, which ensures that the temperature and functionality of the mortuary fridge and cabinet is there. The housekeeping department, which ensures that this rodent problem which you brought out is taken care of. The mortuary is kept infection free, and then the last one is the custodian, which is the security department. So security does a lot of coordination in order to ensure that the all the stakeholders like housekeeping, engineering, biomedical engineering, and medical team. I mean. Nursing, to be precise, they are kept informed about all the aspects of mortuary operations, and when the body is handed over, the SOP is such that the attendants are shown the face of the dead body and asked to identify, and a lot of documentation happens, and then only the body is handed over. So uh, in my knowledge, in most of the private healthcare hospital, I have not come across a situation wherein uh, the wrong body has been handed over to the attendant, and that has led to a security situation. Because inadvertently, in our country, if you hand over the wrong dead body to a patient attendant, it will lead to a definite security situation and the legal problem for the healthcare facility or the hospital. So,
In India, doctors are treated second to God, only as long they treat patients well. Should anything go wrong, there is big chaos, and that doctor becomes villain. A Royd situation takes place. How security team is to respond in such situation?
so this is one of the irony. This is one of the irony of our society or our country. The same person who's treated as God or next to God, uh, if the results are not favorable and the patient dies or something adverse happens in the course of treatment, he is called a Mautha Saudagar, or Chandal, or whatsoever they people whatever term they come across. Now uh, now uh, with the advent of security, I mean, as the security function grew in the private healthcare setup, a lot of interactions started happening with the medical team, especially with the clinician and senior clinician team who are treating the patient. And you'll be surprised, and our viewer will be surprised to know that a lot of dialogue and a lot of exchange of information happens between the security team and the treating team, essentially the doctor who's treating the patient. So we are also kept in knowledge of the patient's condition. We know precisely what is happening to the patient, and a little bit of education about the medical terms and medical treatment path is also imparted to us, so that we know and we can further have a dialogue with the patient attendant if required. Mostly the dialogue happens with the treating doctor and the patient attendant or the patient's relative. But at times, security presence, again, the non intrusive security presence is ensured, so that nobody gets into an argumentative state and tries to assault or create a very unfavorable situation for the doctor, the very same doctor who's probably giving his best, giving his life, almost life's precious time for saving the patient's life. So this dialogue and the exchange of information works wonder for us. So we are also kept in knowledge of all the treatment details and whatever is happening to that particular patient. We also keep in our knowledge the concern and queries of particular attendant. And you know, in Indian scenario, uh, the next of kin, other than the next of kin, a lot of people uh, come and do the round of the hospital during those tough times. I have nothing adverse to speak about those people, but at times more people, more thought process, more half-cooked knowledge creates problem for doctors. Doctor, people need to understand that the doctor's time is precious, and he has, like you and me, he has only 24 hours. And during those 24 hours, he has to treat XYZ number of people or the patient. So if he starts giving explanation, or if he starts explaining the medical processes or the outcome of the treatment to each and everyone, he'll have no time for the patient care. So, ensuring that whatever information the doctor has given us, and for that matter, there's a department called medical administration. That medical administration department, then, and they also have a lot of doctors and paramedic with them. So this information is further percolated down among all the attendants. And these days, uh, in our hospitals, we have a process called multidisciplinary therapy or team. So from various various discipline of uh, medicine, people are brought together at one place, and this entire team has a dialogue with the patient attendant, and they are able then to give the exact description of what is happening with the patient to the patient relative who are more than anxious. So that is a win-win situation for the patient relatives and the doctors. So we do a lot of
Yeah.
coordination. Medical administration department also does a lot of coordination to ensure this dialogue happens, and doctor's image in that case doesn't take a hit. He
In
remains a
fact, yes, in fact, in a hospital, I have seen unruly crowd mobbing a doctor, abusing and physically assaulting, and that was, very unfortunate and very uh, avoidable situation. Uh, there is a question from Dr. Rajiv Mathur, and he is not practicing doctor. He is a doctor because of research. So, Dr. Rajiv Mathur's question is: security has gained its respect and due recognition. In pre-COVID era, the first cost cutting was just being on security. Is the management now more careful and does it listen to CSOs? Your
uh, uh,
response.
I agree with his first sentence, which says that security has gained its respect and due recognition. Yes, sir. This is correct. The security has earned its due respect and recognition. In the first wave of COVID in 2020, and yes, in 2020, all the healthcare service delivery hospitals uh, were hit hard. uh, I said that every service comes with a cost, and somebody has to bear the cost. So most of the hospitals, they tried not cutting down on the security cost and salaries, but during the first wave there was hardly anything to do. Most of the areas were closed down. So essentially, you had to remove a significant portion of security manpower, and it not only happened with the security, but most of the other departments also. People took salary cuts, uh, uh, people worked from home. So this thing happened, but management always listened to its CSO, and now it is up to the security professionals also, uh, how much dialogue is happening with the management, uh, what amount of data we are presenting before the management. Management is bound to listen to the CSO, and I'm very happy to say that in most of the hospitals, healthcare delivery facilities, CSOs advice and their recommendations are heard of, and necessary changes in operations are brought. Yes, in certain aspects, the capex and opexes are at times cut down, but it is not essentially the security wherein people use their seizures to cut down the budget and capex and OPEX are reduced.
Thank you, Rajiv Mathur, for asking this question, and please join our next discussion also. You are very learned and experienced, well-respected security professional yourself. Uh, Back to you, Jitendra. Security should not be seen, security should not be heard, and that used to be the mandate in healthcare sector. But today, not only security is seen, security is also heard. And from non-intrusive, it is intrusive security also in right balance. And additional responsibilities are also given to security team. Now, what is big positive change you see in your sector? And with that, also make your closing remark to you.
Sir, with COVID being in our society, prevalent in our society, uh, we saw a lot of additional responsibility being given to us, and those responsibilities at time were not meant for security, but we took it with a pinch of salt. Uh, yes, because we had to support the management right from the mobilizing our resources in order to ensure the supply chain management, ensuring that our supplies are intact, uh, ensuring that our staff movement is not hindered. This I'm talking about last 2 years situation. Uh, right from the supply chain management, staff movement, ensuring that our staff movement is not hindered, ensuring that all areas are manned, ensuring that our infection control protocols are adhered by our staff, visitors. Our migration from being non-intrusive to the partly intrusive design, it all happened, and security, especially the healthcare security, has become more dynamic in nature, and we are evolving uh, with the medical professionals. We are ensuring that our facilities are safe, secure, and our colleagues, medical or support, uh, they're able to perform their duties without facing much challenges. So this has brought in a lot of dynamism in our sector. Uh, Fortunately, our management and those who are in leadership position, they are also realizing the challenges that we are facing these days, and they are open to our advisors, recommendations, and suggestions. It is a time which is a win-win for uh, all of us, and I see that in all these challenges, the scope for our excellence always lies, and lot of good work lot of good work is waiting to be done. A lot of good work has already happened, and I'm certain in days to come, this pandemic will end, and we'll again go back to our earlier design of being non-intrusive in nature from being partially intrusive in nature, as currently it is happening these days. So
So that is what brings paradoxes in right balance, that we provide security in hotels, in hospitals, and in both sectors. Security was the only function which was not supposed to be heard and not to be seen. In the process, they were not seen and they were not heard. So change has taken place now, and
yes.
it is gladdening the hearts of all security professionals. I'm sure that chiefs of security are now being considered as advisor to the top management in healthcare sector, as critically important as the health giver themselves. And with this, I feel very happy to share with our viewers that we will continue to bring such discussions of high professional values. And kindly subscribe to our channel. Wait for next announcement. Remain happy, healthy, and let's have our near and dear ones safe and secure. May you never need to go to any hospital, but when you go there, be assured that there is a professional team to take good care of yourself. Happy Republic Day to all the citizens, all security and safety professionals. God bless us, and let's meet during next discussion.